About all here. Say hello and welcome to everybody in the audience and out in the gallery. This is the premier, show for the House Health Subcommittee. I appreciate all of you being here today. We will gavel ourselves in and move forward. Does anybody have any personal orders? If none, I have a personal order. I'd like to say a few words to our committee here. I've been involved in lots of committees since I've been up here. It always becomes like a family. We're going to see a lot of each other in the next 2 years. So you can turn your resignations in quickly. But we'll have lots of business. I think we've got about 70 or 70 plus bills that have been assigned to this committee, and we appreciate all of you being here. We try to maintain a quorum at all times. Let us know if you're not going to be here, going to be gone. And so with the entrance of our speaker, I will take the distinct honor of introducing each one of you, and you're welcome to add any information you'd like to add. I'd like to begin with Clark Boyd. I keep thinking this is age 46, but it's District 46, and that's Cannon and part of DeKalb and Wilson County. We've had him for two of our General Assemblies, 110th and 111th. He comes to us from the insurance industry, has two children. He got a BS in Human Development and Military Science in East Tennessee State. He's chaired Consumer and Human Resource, Commerce and Utilities. He was an officer in many of his community organizations and churches and charities. 11 years with the Army and National Guard. Thank you for your service, Captain. You left with the honor of being captain, I think. Well, congratulations. I do try to find out some interesting issues or habits of our members up here, and your staff told me that you're a bicycle enthusiast, that you ride 100 miles at one time, and have hiked several hundred miles of the Appalachian Trail. Any of that true?
Thank you, Mr. Chairman. It's been a while since I've been on a bicycle, but I am trying to hike from Georgia to Maine, and we're in Virginia now, about 500 miles in.
Great. Yeah. See a lot of books and things come out about that. I want to recognize Coach David Byrd. Coach Byrd is not with us. He's still struggling with health issues. And we certainly want to remember him. I'd ask for a moment of silence and in remembrance and prayer that he comes to join us again. Thank you. He's in District 71. He represents Hardin, Lewis, Wayne, and part of Lawrence County. Bob Freeman is District 56, part of Davidson County. We're glad to have him here. He served in the last General Assembly and comes to us from the real estate industry. He has 3 children, graduated from MTSU, master's at David Lipscomb. He's been on many environmental councils, boards, and charities, Consumer and Human Resource Committee, local committee. He's chaired the Davidson City Delegation, and I'm told that from his staff that he is a dedicated patron of jiu-jitsu. And so I thought at the time that it was some sort of a defamation slur when they told me that, but then I found out it's a martial arts program, and I think he is one of the original members of Cobra Kai in Nashville. Is that right?
Yes, sir. The original Cobra Kai, though.
We welcome, sir. Yeah. We have Mark Hall, District 24, part of Bradley County. He served in the last General Assembly. He comes to us from the barber profession. He's a distinct reminder that many of us are enthusiastic about the things that God didn't give us. We he has one child, and he chairs veterans programs and community service programs. He was on the county commission for 12 years, which is a wonderful training ground for anybody that's in our state government service. He has a long history of military service, and we appreciate that. We thank you for that service. He's on the insurance committee, health, and health subcommittee. One thing I found out about Representative Hall is he loves trivia. So have you gotten any trophies or honors in trivia? I've got a trivia group that plays every Monday night, and typically, you know, there's a lot of young people there, and typically if we can't overhear answers, we don't do well. So at our age, the ears mean a lot. But best wishes to you. I hope your trivia works out for the best. Have Leader Paul Sherrill. He's District 43. He comes to us as a small business owner. He represents Grundy, White, and part of Warren County. He has served 2 terms, 1/10 and 1/11. He's got a lovely wife, Miranda, that we traveled with in Israel here last year, a daughter, Marley, and a son, Lee. He's been on the Judicial Committee, Health Committee, Criminal Justice, and he is presently our Republican floor leader. I tried to find out something interesting about Leader Sherrill, and he is a farmer. And he at one time had a mule that he named Democrat. And he had to sell that poor mule because every time he got around him, he got nervous and couldn't perform. Robin Smith, District 26, part of Hamilton County. She's served with us in the 111th General Assembly, has 2 children. She's a project manager and consultant. She has a BS in nursing. She's sat on the insurance committee and chairs now Life and Health Sub of the Commerce and Insurance Committee, and been on the Health Committee. Chair Lady Smith, one interesting thing I see in your profile is the Tough Tusk Award, and I would love an explanation.
Thank you, Mr. Chairman. Years ago, I was nominated by then U.S. Senator Fred Thompson to receive a national award by the Pachyderm Club of the U.S. Pachyderm Club for my tendency to want to win and being tenacious. And that is a characteristic of elephants, and hence the Tough Tusk Award.
Congratulations. We certainly appreciate your service to the state and to the party and the citizens. We have Dr. Brian Terry, physician and anesthesiologist, represents District 48, part of Rutherford, and he has served 3 terms, the 109th through the 111th. He has a lovely wife, Cheryl, son, Braden, and a daughter, Breeley. I think, did I pronounce that correctly? He graduated from the University of Oklahoma, had his MD degree from Oklahoma. He's been a member of many medical societies, a diplomate of American Board of Anesthesiology, comes with a history of the chairing Health Committee, in Insurance, Civil Justice Committee, and I didn't even get a chance to ask his staff what was interesting in his life. When I went into his office, there's this huge plaque up there, and it has all these gold records on it, and it's a band called Shinedown, and he apparently has a very close relationship with this band. It's a kind of a rock band that started about 2001, and I think in Florida, was it Jacksonville, Florida?
Thank you, Chairman. Yeah, they're based out of Jacksonville, but the lead singer and the lead guitarist are lead singers from Knoxville originally. The lead guitarist is from Memphis, and so They are originally Tennesseans.
Do you play yourself?
Absolutely not.
I guess
I don't even want to hear myself sing in the shower.
you're like me. You just listen. Well, that's a very impressive decoration in your office. I got to say.
Thank you.
We have Darren Jernigan, District 60, part of Davidson County, is very close to where we are right now, I guess. He has served four terms, 108th through the 111th. He's comes to us as a healthcare consultant, which I think is very appropriate for this committee. His wife is named Michelle. He has 4 children. He's always been an overachiever, Darren has. 4 children, Harris, Amanda, Elise, and Claire. And he graduated from MTSU and Austin P. He's sat on lots of boards and historic groups. He is one of the few here, I think, that is in the Masonic Lodge. He has chaired Property and Casual Sub, Insurance. He's been on Health, State Government, and been on the Metropolitan Council for Nashville for 7 years and the Utility Commission. One very interesting thing I found out about our illustrious healthcare consultant is that he used to drive Speaker Harwell's sports car. I have yet to figure out what the connection is, except that he's just a lucky guy.
Well, I was. I'll tell the story. I was 16 years old, and Speaker Har was a good friend of our family and our mom. And I was walking home from school, and there was a candy apple red sports car in our driveway. And I thought, oh, my parents have done it. And I throw my bags up, I'm running home, and I go in, and Beth, my mom's in there, so I realized it was her car, but she was the first one to take me 0 to 60 in a car, and that's when I realized I wanted to go into politics. So
there you go. It's worked well for you. It worked well for us. We appreciate you. Dr. Sabi Kumar, the District 66 in Robertson County. He served with us for 3 terms. His lovely wife, Linda, we'd accompanied them as a couple over to Israel last year and had a wonderful time. He has a daughter, Nina, and he is a board-certified surgeon. He's had many medical staffings and fellowships. He recently was the clinical professor of surgery at Vanderbilt, and he's been involved in many community organizations. He's chaired mental health subcommittee, been a member of finance, health, and education. And one terribly interesting thing I found out about Dr. Kumar is that he has 3 patents on medical devices and owns a company that manufactures these patents. So congratulations, sir. That's quite a story. Speaker Pat Marsh, District 62, Bedford, and part of Lincoln County. He's been with us 6 terms. Just maybe a month or 2 less than I have. When he was running for a fill-in candidate, I think we had a retreat, and I did phone calls for you and your district, and so everybody that answered said, "Oh, Pat Marsh, I love that man. He's got my vote." So he comes to us as the co-owner and CEO of Big G Express. He has wife Mary, son Rob and John, grandson Walker, granddaughter Mary, Anna, Maddie, and Kate. He and I are the only ones with grandchildren up here. That tells you something. He's been the chairman of Consumer, and he's involved in many organizations in his community, and is involved in one of the members of Walking Horse National Organization. He's chaired business and utilities, ag and commerce, and the only thing I could find out, he lives a very secretive life. So the only thing I could find out was that as a child, the speaker played with Tonka toys. that's why he ended up with a truck company. So we're fortunate. We have 2 Baptists, 2 Presbyterians, 1 Methodist, 1 Nazarene, and 3 Christians. So any questions about our spiritual strength should be laid to rest. Appreciate all of you. I have a few Things that I'm commanded to speak about here today in our committee, this being the 112th General Assembly. The committee will start promptly at 12 noon. I usually try to be here 10 minutes early. The sponsor of a bill and requesting a roll call must request the roll call prior to any vote being taken. No lobbyists or visitors will be allowed on the dais 4 or 5 minutes before the meeting begins. Once the chairman has made a ruling on a vote, only by show of 3 committee members' hands may the roll call vote be requested. Such a request must be made before the next bill is called. The amendment deadline is 10 a.m. Mondays, the day before the amendment is to be heard in committee. Bill notices must be submitted in the online portal by Wednesday, 3:30 p.m., the week prior to the bill being heard. The voice amendments will not be entertained unless clerical in nature or making technical corrections, and of course that's always up to the discretion of the committee. There will be no running debate. Members may speak only when recognized by the chairman, and no personalities will be allowed. Debate may be limited in time at the chairman's discretion. If there are several speakers, please appoint a spokesperson. Members bringing guests who wish to speak must give advance notice to the committee staff by 12 a.m., 24-hour notice the day before the committee is scheduled to meet. Paper will not be distributed in this committee. If anyone wants materials distributed to members, it must be provided to committee staff electronically prior to the meeting so that it may be emailed to the members and added to the dashboard. These policies are waivable by the chairman at his discretion. There will be, by the new rules, no filming, no streaming. Bills will be calendared 3 times. If they do not have action after being calendared 3 times, they will be sent to a special last calendar. And I was told here just a day or so ago that we do have options of sending bills to summer study, and we do have a general sub status in the House at the moment. We have no committee roles. My office is always open. And if you want to be recorded on a vote other than the prevailing the decision, please alert the clerk. You will receive process forms, and anybody that asks you about these, our chairman, Terry, prefers to get these process forms for members that put bills on notice. Those will be made available. You will send those process forms to Harris King for him to enter into the portal for reviewing by other members. Those will be available to these members, and certainly we encourage you to look at those before we discuss the bill. Harris King will add them for the members' review. Use of the process form will be used by Chairman Ramsey and Chairman Terry. The amendments portal electronic information must be used. We had an issue come up this week that an amendment was filed in a timely form in person, but they have to be done in a timely form on the portal, which can be an issue because the portals don't work when you leave the premises. So anything else that comes up, we'll try to deal with. I do want to have some other staff that's represented here today that we want to acknowledge. Let me dig through here. I've got that list. Oh, there you go. The staff introductions that we have, Committee Attorney Matt King. Exceptional. All these folks are exceptional. Committee Assistant Rochelle Frazier. She's kind of the gatekeeper. I don't guess I need to tell everybody. Research Analyst Harris King and Will Walker. We have Harris, and Will sometimes comes in afterwards. Clerk Seth Beatty, back in the corner. Sergeant at Arms Wayne Hawkins. Is that Wayne down there? Interns, they're infrequently here with us. Alyssa Hobbs and Sydney Satterwhite. So we'll try to make use of them over the year's time. That brings us, if there's no personal orders that we have extended, that brings us to our calendar for today. Oh, I'm sorry, the clerk, take the roll, please.
Representative Boyd. Here. Representative Byrd. Representative Freeman. Representative Hall.
Here.
Representative Jernigan. Representative Kumar. Representative Marsh. Representative Sherrill. Representative Smith. Representative Terry. Representative Ramsey.
Here.
Chairman, you have a quorum.
Thank you, Madam Clerk. We have item 1, House Bill 81 by Leader Lamberth, which is an administration bill. I think Representative Rutter is going to present that for us. You're recognized at the well. Have a proper motion and second on the bill. If you'd like to explain the bill to us. Don't believe there are any amendments.
Get this microphone turned on. Yes, this is an administration bill, and this legislation seeks to increase the efficiencies within the Department of Mental Health and Substance Abuse Services by aligning the statute with department practices. And with that, I'll be happy to answer any questions.
Do we have questions of the sponsor from the membership? If no questions, we will be voting to send this bill to full committee. You already got it? Yeah, we got it. Yeah. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chairman and committee.
Thank you for being our premier sponsors. We have item 2, House Bill 80 by Leader Lamberth, which is an administration bill. I think Leader Gant is going to be our sponsor for that. You're recognized. We have proper motion and second on the bill. I don't think there are any amendments. If you'd like to discuss the bill with us.
Mr. Chairman, Dr. Kumar is going to carry it for us today.
Oh, okay. Dr. Kumar, you're recognized.
Thank you, Mr. Chair. This is also an administration bill, and it's about making some changes to the current controlled substances monitoring database. The data in that is sensitive, and the sharing of that is very well controlled. This bill allows the data to be shared in de-identified manner with certain other entities such as states, agencies, as well as the medical examiners. And it also changes the quorum of the board for the CSMD database from 7 to 6 members, which is still a majority. It's not a 2/3. With that, I'll be happy to answer any questions.
Yeah, my understanding is that this bill was I think promoted last year and then was lost in the chaos of the pandemic. So I think it's just left over for some clarification last year. Do we have any questions of the sponsor? If none, we've had the question called on the bill. If no objections to the question, we'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved. Thank you, Mr. Sponsor. Item 3 is House Bill 215 by Chairman Curcio. Have a proper motion and second on the bill. I don't know that there are any amendments. If you'd like to explain the bill, sir.
Thank you, Mr. Chairman, and thank you, committee. I tried to get around and talk to many of you, and then the snowpocalypse hit, so I apologize if I didn't get back around to speak to everybody individually. But this is a bill that, of course, I know it was a different committee set up then, but that passed last year through the committee system and passed the House floor 98-0. And it's called the SAFE Act. And it's actually a continuation of something I've been working on since I entered the legislature that's near and dear to my heart, which is to making sure that if we have sober living homes in Tennessee, which are certainly allowed and they're protected by federal fair housing, I don't want that protection by federal fair housing to allow flop houses, what are called flop houses, to fly under the radar and for people to not truly get the type of treatment and services that these houses are putting themselves out there. So what this bill would simply state is that if you're going to operate a sober living home in the state of Tennessee, we would like for you to join a national accreditation body. We're agnostic about which one you join. There are several to choose from, and I can list some of those for you if you have them. But NAR, the National Alliance for Recovery Residences, the National Sober Living Association, NSLA, or the Commission on Accreditation of Rehabilitation Facilities, also known as CARF. Any of these, plus any number of others, but we want you to join an accreditation body, and by doing so, that sort of gives a good housekeeping seal of approval, if you will, to that house. If you have houses that choose not to comply with that, they can still operate in the state of Tennessee. But as we have an existing code, we've borrowed from the existing SAFE Act, which I passed a couple of years ago, to say you've got to put up a sign that says this house does not adhere to best practices, nationally recognized best practices, so that consumers can know. So if heaven forbid, if I have a child who needs to go to a recovery residence and I walk in to check them in and I'm paying, good money, $1,200 a month or something for them to live there, and there's a sign in the common room that says, oh, by the way, we don't do things according to best practices around here, that's going to cause me to ask myself, well, why am I doing business at this place when I could go next door and maybe get better services and that follow best practices. So a few more details in the bill. I'll try not to belabor the point, though. I'd be happy to answer any questions.
Do we have any questions or comments on the bill? If none, question's been called, no objections to the question, we'll be voting to send this bill to the full committee. All those in favor say aye. Aye. Any opposition? So approved. Thank you, sponsor. We have, item 4, House Bill 7 by Chairman Zachary. We have a proper motion and second on the bill. I think there is an amendment, and I'm understanding that the amendment makes the bill.
Yes, sir, Mr. Chairman.
Okay, we have a proper motion and second on the amendment. I heard two mumbles there. So we are on the amendment. It is Amendment 3619. Is my understanding?
Yes, sir. That's correct.
And if you'd like to describe the amendment to us.
Yes, sir. Yeah, with your permission, Mr. Chairman, I'll give just a little background and explain the amendment which makes the bill. This pandemic has revealed and has brought to the forefront many issues and challenges. One of those primary issues that we have faced is that related to health boards, unelected health boards in our 6 largest counties that have been given through TCA 68, been given basically unlimited authority to issue orders, mandates, function as a legislative and executive branch. In Knox County, it's been a tremendous impact on the direction of our county during this pandemic because the health board has been at odds with our elected county mayor, our elected sheriff, and our elected law director. I see Chairman Smith down here in front. Hamilton County has a health board, but they haven't had those issues. Their health board functions as an advisory board. Davidson County has a health board. They've been on the same page. Madison has had some issues. Again, we've had issues in Knox County. Sullivan, they do not have a health board, so it doesn't impact them. So what this piece of legislation does, it simply addresses the health board. It moves the health board into an advisory role. It does not address the Department of Health. The health department within the particular counties. It does not address the health director. It only addresses the unelected health board and simply moves them to an advisory role, which is the role they should be in. In Knox County, before this pandemic began, on the health board's website, it had them listed as an advisory board. And so what this pandemic has revealed, this has been in the book since 1985, that the words adopt and enforce are used in TCA 682601, which gives this health board unchecked power, unlimited power. They are accountable to no one. If our county mayor objects, there's no recourse for the county mayor because statute gives them, this unelected health board, unlimited power. I think everyone is familiar with the phrase from the Declaration. I believe it's the 4th line, where governments derive their power from the consent of the governed. That is not the way our government, having an unelected health board be able to issue mandates and orders is not the way our government works. We have 3 branches of government. We do not have 4. And so I don't see this as a partisan issue. I've talked to my colleagues on both sides of the aisle. You can take the issues of masks, gatherings, all that out of it. This is a fundamental broken piece of code which gives incredible power to unelected bodies. And just to clear up some misinformation, related to the health boards, most people think they derive their power from the state of emergency that we're currently in under TCA 58. That is not the case. The real concern with the health boards and us moving forward is that when the governor ends his state of emergency, he can no longer step in via statute. He can no longer step in and stop any action of the health board, which is what he can do today because we're in a state of emergency. So these health boards can continue to issue orders and mandates at the objection of the elected county executive if they choose to do so. And it's got to be fixed. It's got to be addressed, and it's got to be addressed now by this body. And let me just give a couple of quick examples, Mr. Chairman, then I'll be done. Probably one of the more egregious things that we have seen in Knox County, just to give you an example, is our health board had prepared and actually issued on their agenda, they were going to ask the governor to give them the authority to regulate every county that touched Knox County. Chairman Ramsey, Blount County would have been one of those. They were literally going to request that each one of those counties be subject to their jurisdiction. And fortunately, people in our county rose up and people in the other counties rose up, and they pulled that from the agenda. And then the last point I'll make, Mr. Chairman, is that there is an issue, and Farm Bureau may have talked to some of you about this issue. There's an issue right now in one particular county that wants to make a really unpopular political decision. And they are considering forming a health board because this pandemic has revealed the power of these health boards. And so they are considering forming a health board so that the elected body can push a decision to the health board because there's no accountability and no recourse. And so that's a decision that's actually being considered right now. And if Farm Bureau hasn't talked to you, I'm sure they will at some point. So, Mr. Chairman, with that, I will rest in my presentation of this. Again, this simply moves, this 68-601 is the section related to the health boards, simply moves them to an advisory role. It does not in any way impact the independent health departments in the 6 counties. The health officer has no impact. It simply moves this board to an advisory role. And then I lied, Mr. Chairman, I'll make one more point. One objection that I've gotten to this is, well, it's the health experts. You got to let the health experts make the decision, help guide this process. And I agree, we have to have our health experts and those that specialize in this helping us make these decisions, just like we do on the state. Commissioner Piercy and her team have done a phenomenal job advising the governor, walking him through this, and then he makes the ultimate final decision. Well, the same thing should apply in our counties. And so these boards, while we have to have boards like this to advise, this board is constructed in a way that they're able to advise on multiple issues. And the reason I say that and bring that up, just so we're clear, the health board is made up of a pharmacist, a professor of nursing, a dentist, our mayor, a citizen representative, a vet, and our superintendent of schools, and 2 additional doctors. So again, a perfect advisory board gives you many different fields and different expertise to be able to advise. But again, that's what they should be there for, simply as an advisory board. So with that, I will stop and take any questions.
We have Chair Lady Smith.
Thank you, Mr. Chairman. I want to come in and thank Chairman Zachary for bringing this legislation and just simply say that we have accepted the false narrative that we can't have our liberty, our religion, our good governments, and take care of public health at the same time. And I want to, on behalf of Hamilton County and speaking from our mayor, thank you for codifying the practice that's right now implemented in Hamilton County, and just wish everyone the best as this is moving forward. But just know that in practice, this has worked very well already in Hamilton County and a few others. But it is important for elected officials to carry that last moment of decision making. But thank you, and you have my support.
Thank you.
We have a question called on the amendment. If there are no objections, we'll be voting on the amendment to place it on the bill. All those in favor say aye. Aye. Any opposition? We're back on the bill as amended. We have questions or comments on the bill. And I would like to ask, I think we had talked about this several times. I've sat on the Board of Health in Blount County for 25 years, and I've also been a county mayor. And so the way that you had described it was that the authority changes once the county mayor describes an emergency. Is that Is that?
Yes, sir. That's actually, so I'm glad you actually brought that up. So Section 1 of this bill, I had gotten some questions about that. So when this leaves this body, I'm actually going to talk to Chairman Terry about this. I'm just going to strike Section 1 completely. It's not even going to be in the bill when you see this in full committee.
And that was what you had described to me.
Yes, sir.
So that portion of it, this is going to be all boards of health all the time.
The board, now, just to be clear, Mr. Chairman, you're in Blount County, so it's different than
Right.
Knox or the other
Sure.
other 5, because we have our own health department, and then we have the boards there, and so it's a little bit different. But related to anything state of emergency executive powers, we're going to strike that section. That's not even going to be part of the bill.
Okay. And I'm left a little bit questioning just a little bit, because there are a lot of things that the Board of Health do that nobody else wants to touch. They condemn hazardous property. I mean, when the county mayor gets a complaint that somebody's not keeping their property up and there are rats on it, that's the people we have to go to take action. The rabies programs, STD programs, inspections of restaurants and things like that. They take a lot of issues that really the county government don't want to deal with. Is that going to change?
No, sir, because we're not addressing that section of code. That power rests with the health department and the health director and officer. So that we don't even open that section of code. We don't touch that section of code.
And one thing I was thinking of specifically, they have at times passed ordinances to regulate the vaping and smoking under state laws, so that's not going to change
No,
either.
sir.
Okay,
No, that doesn't
Thank you.
change.
Great explanation. Do we have any other comments or questions? Yes, Dr. Kumar.
Thank you, Mr. Chairman. Thank you, Chairman Zachary. I think you know that I was skeptical about it because, again, I felt that decision-making on medical matters should belong to the health science experts. But I see the model that you present in which the mayor, being the elected officials, makes the final decision and seeks advice from this expert panel. And the expert panel, although scientific, should not really have the power to implement. Am I correct in
Yes,
that?
sir. Yes, sir. 100%. Yes, sir.
And which board did you mention functions at this time as an advisory board?
Well, initially, when this pandemic began, on the Knox County website, it listed them as an advisory board. So this has been on the books since 1985. No health board has ever exercised this kind of power because they didn't know it existed. So we began to have some friction in Knox County, specifically in Knox County when this pandemic began. And so we had to go to legal, our law director, we had to bring the state in to really clarify who had the power. And it became apparent through statute that the power actually ultimately rested with this unelected health board.
Well, thank you for correcting this constitutional aberration, I guess.
Thank you.
Thank you. Thank you, Mr. Chairman.
Further comments or questions on the bill as amended? If none, we'll be voting to send this bill as amended to full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, Mr. Chairman and
Thank
committee.
you. And we're down to item 5, House Joint Resolution 4 by Representative Lamar. You're recognized at the well.
Thank you. Thank you, committee. Thank you, Chairman. The goal of this legislation is to clarify the role of a doula. A doula is a trained non-medical person who provides non-clinical, emotional, physical, and informational support before, during, and after labor and birth. Doulas are necessary and impactful members of the childbirth team whose presence can have a positive impact on maternal and infant mortality in Tennessee, as well as to be beneficial to communities of color, low-income communities in this state because of doulas. They provide 4 key forms of support: physical, emotional, informational, and advocacy. Right here in Tennessee, Black mothers are dying at higher rates. Our Tennessee Department of Health found that in 2017 and 2018, 46 Black women died while pregnant or with 1 year of pregnancy in Tennessee, and 100% of these were deemed preventable. It is a fact that doulas reduce the rate of women dying because of pregnancy-related issues, and they ensure that we can combat our infant mortality rate. I ask for your support for this piece of legislation.
Okay, well, thank you very much. I had signed on to this resolution, and we all have followed closely your family situation in the last year and have the deepest sympathy, and we hope that everything has recovered to somewhat normal. And do appreciate your insight. Of course, I got an earful about doulas from Rochelle Frazier, my chief assistant. She's been involved with one in her family in the last couple of weeks. So I'd like to open the floor for any questions or comments about this bill, resolution. Question's been called. If there are no objections, we'll be voting to send this to the full committee. All those in favor say aye. Aye. Any opposition? So approved, and we
Thank you,
appreciate
committee,
you so
for your
much. We'll go to item 6 by Chair Lady Smith, House Bill 146. You're recognized.
Thank you, Chairman. And I do have an amendment, Amendment 3638.
Does it make the bill?
It does not make the bill, but it
Okay.
does add an important reporting agency that will receive this. So I would like to get it in a proper position.
Okay, we have a motion and second on the amendment. We will discuss the, go ahead and discuss the bill and the effect of the amendment, if you like.
Thank you, Mr. Chairman, and thank you, committee. As you will remember, last year and really at the end of 2019, Tennessee made some unfortunate headlines in an unknown large reserve of over $725 million, almost $1 billion, that had been accumulated in unspent funds. And again, being a conservative body, we don't just spend money; we want it to be invested in the lives of Tennesseans. But this large sum of money was unspent. It was unknown. And this is simply a bill that would direct on a quarterly basis the reporting to our leadership here in the legislature and the finance committees, as well as the leadership in our committees of health, on a quarter by quarter basis, federal funds, not just limited to the Department of Human Services, but others, so that we can avoid such a position that we found ourselves in just over 18 months ago. And with that, I'll be happy, Mr. Chairman, to answer any questions.
Is that an explanation of the amendment as well?
It does include that, yes,
Okay.
sir. The amendment specifically added the committees on health in both the Senate and the House.
Okay, let's go ahead and vote on the amendment. Okay, yeah. Do you want to, on the amendment or the? Okay. We have a question on the amendment before we vote.
Please.
Thank you, Chairman. It's not really a question, it's more of a statement. The amendment, it was to ensure that the chairs of the Health Committee in the House and Senate did receive this report. I served with Representative Smith on the TANF working group, and I just wanted to make sure that we received that information. That's what this amendment does.
Further questions or comments on the amendment? If none, we'll be voting on the amendment. All those in favor of putting the amendment on the bill, say aye.
Aye.
Any opposition? So approved. We're back on the bill as amended. We have questions or comments? If not, we'll be voting to send the bill as amended to full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, Mr. Chairman and committee.
Thank you. And we have item 7, House Bill 179 by Representative Hall. You're recognized, sir. Have a proper motion and second on the bill.
Thank you, Mr. Chairman and committee. House Bill 179 is a cleanup bill brought to me by the Tennessee Primary Care Association. Basically, this grants the FQHCs the same liability protection as other medical facilities. And with that, I rest, Mr. Chairman.
And I think this also is a situation where the facilities were left out of previous code, and so just kind of a repair. Any comments or questions on the bill? If not, we'll be voting to send this to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chairman and committee.
And we have you on House Bill 180. I think you've decided to roll that.
If I could roll that, Mr. Chairman.
Okay, one week.
Yes, sir, 1 week.
Any objections to rolling 1 week? If none, we will roll that 1 week.
Thank you, sir.
And item 9, House Bill 508 by Chairman Boyd. You're recognized. We have a proper motion and second. It has an amendment. Does the amendment make the bill?
The amendment, Mr. Chairman, which is drafting code 003746, makes just a few technical changes that were sent to us by the Department of Health and Department of Mental Health.
Okay, let me get a motion and second on the amendment. We'll just discuss the bill and the amendment. Go ahead, sir.
Thank you, Mr. Chairman. And just to clarify, anytime the word telemedicine is brought up, there are a lot of people that the hair on the back of their neck stands up because they're afraid we're going to get into insurance reimbursement rates. This does nothing of the sort. This basically deals with graduate and doctorate level professionals under Title 63, which would be behavioral health, speech pathologists, people like that, that have to do a certain amount of practicum or internship hours, and this allows them to use telemedicine in order to meet those requirements. I'll take any questions, Mr. Chairman.
Do you have any questions or comments specifically on the amendment or the bill? Let's go ahead and put the amendment on the bill. All those in favor say aye. Any opposition? We're back on the bill as amended. Yes, sir. Representative Freeman.
Thank you very much. I've gotten a few phone calls, and I know the answer, but I want to hear you say it as well. The question that I've had multiple times, sponsor, is will they be required to be supervised by a licensed individual?
You recognize it.
Thank you, Mr. Chairman. They will. This doesn't change anything other than the use of telemedicine technology to do it, and they will be supervised by a licensed professional.
Is that further questions?
Yes, thank you. This is, thank you for bringing this bill. This is very needed and will do a lot of great good.
Further questions or comments on the bill as amended? And we do appreciate that. There are several things that have been opened up by the administrative orders and that we're going to make permanent. So I appreciate you bringing that forward. We'll be voting on sending this to the full committee. All those in favor say aye. Any opposition? So approved.
All right, we are on item number 10, House Bill 183 by Chairman Ramsey. You're recognized. Motion and second? Okay.
Thank you.
You're recognized.
And I appreciate you so much, Mr. Chairman. We had two amendments on this bill. One is just a catch-up from last year. The other one, I think, has been withdrawn.
Yes.
Okay. And I'll be glad to discuss the bill before we discuss the amendment, or we'll put the amendment on. What happened, we passed this last year, and so we're having to change the date in the bill to reflect being presented this year. So that's essentially all that the amendment does.
Okay, let's get the amendment on the bill so we can discuss the bill. So we need a motion and a second on amendment 003697. We have a motion and a second. Any questions about the date change there? Okay, seeing none, we're voting on amendment 003697. All those in favor say aye. Aye. Opposed? Okay. Okay, we're back on the bill as amended.
Thank you, Mr. Chairman. And this bill, I've spoken to most of you about it maybe several years. The bill is addressing only licensed and professional art therapists in Tennessee. Between World War I and World War II, art was found to be an effective way in communicating with children, adults, and seniors that were suffering from brain trauma, brain injuries, psychological trauma, and just flat lacking communication skills. In 1942, the practice of art was used with psychotherapy, and was standardized. And in 1994, the Art Therapy Certification Board began the National Credentialing for Art Therapy Board certification. This bill, by adopting the licensing status for art therapists, practice in Tennessee will do several things, and then several things it won't do that some people think it will. What it will do is it'll increase access to affordable, quality mental health care providers with a positive fiscal note, and you can see the fiscal note on the report. It will do so while generating revenue for the state. At the close of 2020, in the legislative session, as you remember, many bills were ignored that didn't have to do with COVID relief. Pretty much we were told that only COVID bills would be considered. And I'm told by our, that no bills passed last year addressing mental health for specifically mental health or for COVID relief, either one. And I'm told by our largest mental health counseling provider in my region that new counselors are, excuse me, moving away from the profession because there has been no increase in pay in years, and it's a difficult and long training program. And so, in effect, what we're looking at is even more difficulty in getting folks to this field when there's actually a bigger need for it. Close to 1 million Tennesseans were diagnosed with mental health issues, and in our lifetime, 1/4 of us will be diagnosed with a mental health situation. Continually, less than 50% of the adults receive the help they need, and currently Tennessee ranks among the worst of all 50 states in access to mental health care for children, which we find statistically that less than 30% of the children with diagnoses actually receive care. The governor has announced this year that he's going to put some more money into mental health care, but it's going to come through the children's programs and the DIDD department that is not going to go to TennCare. So although TennCare is not going to have their 2% decrease like they thought that they would, they're going to be stable, and there's going to be no increase. And typically 50 to 80% of counseling is done within TennCare, and we're talking about children. So art therapists are really a key, a portion of the solution. They have a master's level mental health status and training, specialized in education and training to effectively work with all ages and a wide range of mental health needs, including depression, anxiety, substance abuse and trauma, PTSD, schizophrenia, substance abuse rehab, and cancer sufferers. Close to 90 art therapists across the state are working in medical and psychiatric hospitals, clinic schools, nursing homes, communicating settings, and a lot of them are not working in their field because of the status of their licensure. The art therapy profession has been heavily researched and found to be effective over decades. The Department of Defense actually appreciates the usefulness of it and employs art therapists to work with veterans and active military service members for brain injury, PTSD, and related psychological issues. Second, Lady Karen Pence has made rising awareness and access to art therapy her signature cause beginning in 2017. And she actually set up an organization called Healing with Heart Initiative. The Veterans Administration understands the usefulness of this in particular areas and has actually set up a clinic in Clarksville. And Lady Pence actually came and visited that to highlight what they were doing there. And in questioning the organization, without licensure, you can't work there because it has federal funding. And so that's one of the big issues that we're looking at. We actually have 7 schools of higher education that have undergraduate programs, and actually MTSU is planning a doctor or a master's program that will allow the master's identification in the 1,000 hours that's required in residency before they can be certified with a national board certification. That's what the bill will do. What this bill will not do is it will not stop anybody from using art personally or professionally. I took an art course over at UT, and somebody said, well, why didn't you go arrest the teacher? Because she didn't claim that she was a professional art therapist or a licensed art therapist. And that's the only 2 categories that this applies to. It has nothing to do with Sunday school, has nothing to do with art teachers in school, unless they want to be included in those 2 categories. It does not have a new regulatory board. What will happen by the language of this bill is that there will be an advisory committee established in the Board of Psychology, and it'll be a 3-member board appointed by the governor, and they will actually draw dues. It does not cost the state any money, and it does not in any way define the term of art. So your vacation Bible school teachers have nothing to fear. Your teachers in schools, it absolutely does not define art. The facts are that it does create a professional license for art therapists in Tennessee under the Board of Examiners of Psychology. And we know that creating the professional license for the field of art therapy relates to better mental health care. I've called my regional service people, my regional providers, and they say that it's a great adjunct to what they do, especially with children, autistic children. It relates to better mental health, and has been approved in 17 states where similar legislation has already passed, and I think we have about 30 more that are considering it at the time. It increases access to master's level qualified mental health professionals, protects the public, creates jobs, contributes to Tennessee's economy, and will bring more art therapists to Tennessee. And the MTSU program that's being designed, it's hard to get people to be involved in undergraduate or graduate programs if they can't be licensed in the state. And so that's kind of where we find ourselves. Tennesseans need us to vote for this. It's so that mental health and art therapy can be more accessible. We had last year, we don't have her this year to speak to us, Dr. Sylvia Ritchie of the Associate Medical Director of the Integrated Oncology at West Cancer Center that's in Memphis, Research and Institute. She came and spoke to us last year, and she told us that they really, because of the fact that they treat cancer, they treat people in very difficult situations, that they found it just really compelling to have an art therapy program. And what was so interesting about it, she said they could get no reimbursement for it because they did not have licensing. And so somebody asked her, how did you pay for that? And she said, we find it in our budget. She said it's so important. And one of the most interesting things about it was that they found that the staff actually used it in comparable percentage because that's a tough business when you're dealing with people that are typically in very poor health. That's very stressful on the employees, and she said that they found that it was as useful for their employees as it was for the patients. So I got more information, got more that I can share on that, and I will await questions to do so. If your beard hadn't grown long enough.
Thank you for that thorough explanation. There are members that are wanting to ask questions on this, but we have some folks that would like to testify and which may answer some of those questions for us. So without objection, I'm going to go out of session and have Stephanie Witt and Braden Busak come up to testify. Without objection, we're out of session. And for the record, tell us your name and who you're with, and to the microphone, please.
All right. My name is Stephanie Witt. I'm the Executive Vice President of Beacon Impact. And thank you to the chairman for allowing me to testify today, and also to Chairman Ramsey for hearing us for the past couple of years as we've discussed this bill going forward. This is my colleague.
My name is Braden Busak. I'm the Vice President of Legal Affairs at the Beacon Center of Tennessee, and I too thank the committee for the audience.
So we're here today to testify in opposition to the bill as it's currently written. And the reason for that is that a couple of years ago, there was a bill that was passed by the General Assembly called the Right to Earn a Living Act. And in that bill, the General Assembly contemplated occupational licensure as a whole. They went through the different, licenses that we had in the state, and the Government Operations Committee is making recommendations as to whether or not some of those licenses should continue to go forward, but also any new license that comes up should be looked at through the lens of what is the least restrictive means to regulate an occupation necessary. Full-blown licensure is the most restrictive of those. Below that is a registration that would allow people to still be registered with the department, but also not be as restrictive as a full-blown occupational license. So whenever there's a new license that comes up, it's something that we take a look at to contemplate whether or not it's something that's needed in the state, and at what level and how much something or a profession needs to be regulated. When we looked at art therapy, specifically, we found that there are only 9 states that currently license art therapists, and 5 of those don't license them as their own separate license. So only 4 of the 9 actually license it as a separate occupational license. The other 5 that do license it put it underneath of another license in the Board of Psychology, and they can have an endorsement on that license. So say you are a licensed psychologist, you can then put an endorsement on your license to say, I also am trained specifically in art therapy. We think the bill as written goes really broad, and is one of the broadest in the nation for art therapy. And also, the definition of what art therapy is extensively broad in the bill. It also creates a new advisory board attached to the Department of Psychology, or to the Psychology Board. And in that attachment to it, it mandates that the governor only consult with one organization, in particular, the Tennessee Association of Art Therapists, in determining who should be on that board. We typically don't name things in the statute anymore in the General Assembly. Over the past, 10 years that I've been up here, it's been a practice that has been not something that we continue to do. This does name a specific association and does mandate that the governor only consult with that, or consult with that association for the members of this committee. Also, we do have some First Amendment concerns with the fact that art is not defined in the bill. What constitute art would be up to that advisory committee on who's practicing art therapy and who is not. And it creates a new crime, a misdemeanor crime, and says that anybody that is determined to be practicing art therapy without this license is subject to a misdemeanor crime. We've talked to some marriage and family counselors who are willing to come up and testify in any committee that are concerned that they use art therapy in their current practice as a family therapist. And they're not specifically trained in art therapy, but they use art when they work with children, and they have some concern that they might get caught up in this licensure. So those are some of our main concerns. Braden's here because he's an attorney and he's a lot more briefed on First Amendment issues and art in general, and the definition of art and what is and is not. He'd be happy to answer any questions as it goes to that.
While we're out of session, do we have questions for them while they're up, for the Beacon Center while they're up here? I do have a question, a couple questions for you. Does someone else have? How about- all right. You mentioned something that I thought was kind of interesting, which I had not heard before. So, in medicine, we have board certifications, and I'm a physician, board certified, anesthesiologist, but then there's other subspecialties that I can get certified pain specialist, critical care. That's something that can be as a subsection below my license and not necessarily create a new license. Is that what I was hearing, how you described? Is that something that could be done?
Correct. So there are only 9 states that license art therapy at all. And then of those 9, 5 do not have it as a separate license, but instead of an endorsement type of license on another therapeutic profession.
Okay. Do you know how that impacts, like, any reimbursement or anything? If they're a licensed therapist and then they have a certification underneath that, does that, maybe that may be for the next person that's going to testify.
Yeah.
That's something I would just like to know, how that impacts reimbursement for what they do.
Yeah, and we've talked to the Art Therapists Association. We definitely are not opposed to art therapy in any way, shape, or form, and I want to make that clear. We just believe that there's another way to accomplish that goal of reimbursement that you were talking about that is important in the medical field. Registration could accomplish that. I think an endorsement could accomplish that. But we would have to look at the language to make sure that that was a possibility.
Okay. It just had dawned on me the way that you had described that. That's the first time I'd heard that it potentially could be done that way. Another question towards the misdemeanor. Could you speak towards that?
Yeah. So we also found that it was interesting that there was a new misdemeanor crime being put into this bill, which we felt went a little too far in somebody that may not be doing anything that they thought that they were doing outside of their scope or was wrong. In the bill, it says that if you're currently practicing in another field, you're exempted from this licensure if you're licensed as another professional. But what's not clear is if it says within your scope. So if it's not specifically listed that art therapy is within another therapist's scope in the statute, you could potentially be practicing art therapy even though you're a licensed psychologist without knowing that you are breaking that rule.
Thank you. Representative Hall?
Thank you, Mr. Chairman. I understand that the first rule of medicine is to do no harm, and I think medicine and therapy alike is best achieved when we attack it as a group effort. And I like the legislation for the simple fact that I'm looking for something that moves the needle in a positive way. And like most representatives here, we're here to improve the people's lives of Tennessee, and whatever that looks like. And I don't think therapy is a one-size-fits-all. Mm-hmm. And I understand that you have some concerns, but I think that it's worth the risk. I think it's worth taking the chance on improving people's lives, however that looks like in the future. And maybe they're doing that now, and maybe it looks different, and maybe it's not defined the same way. But at this point, with depression, PTSD, and a host of other mental illnesses that are on the rise, I'm willing to gamble on it. That's my stance. That's all.
Thank you. Any further questions while we have them up here? Okay, seeing none, thank you for your testimony. While we are out of session, we have a Katherine Harris and a Paige Scheinberg. Okay. And for the record, just tell us your name and who you're with in the microphone, please.
Sure, thank you. Members, so much for your time and your attention here today. Can you hear me? My name is Katherine Harris, and I am an art therapist here in Tennessee, working in Nashville. I'm also a volunteer with the Tennessee Art Therapy Association. And we've been working for several years now with our sponsors, Representative Ramsey and Senator Becky Massey, on this bill. And so I really do appreciate your time and your attention and just your willingness to talk about it today, because I think that is one of our main goals, is to have a conversation about the state of mental health in Tennessee and to look at how art therapy can really help with that. And I know Representative Ramsey said a lot and spoke to the benefits of our profession, and there are a few things I can add to it, as well as clear up some of the maybe concerns or information that was just presented by the Beacon Center. I do want to take a step back and really talk about what a collaborative effort this bill was when writing the original language. We not only worked with our sponsors, but we worked with the Tennessee Psychological Association that represents the Board of Examiners of Psychology, where this license will fall under. We worked with the Tennessee Medical Association. We worked with the Department of Health on a lot of aspects of the language to really make sure that these different areas, these professions in mental health and healthcare, were happy with the language, were amenable with how this was created. And I believe there's a representative from the Tennessee Psychological Association who's willing to testify that they are happy still this year as the bill has been filed in the original language. Because of that collaboration, because of the work that art therapists do, we've also received many letters of support from different organizations in mental health and healthcare, including Alzheimer's Tennessee, Amedisys Hospice. The Representative Ramsey spoke to the West Cancer Center and Dr. Sylvia Ritchie, who said she's more than happy to come back this year and speak again to it. The Cumberland Healthcare Social Workers, the director of the Tennessee Mental Health Association, representatives from Middle Tennessee State University, who have approved this year the first ever master's level program in art therapy. And they're willing to testify too to the benefit of licensure to attract students to that program and also keep those students here in Tennessee once they graduate so they can serve and help the individuals who need mental health treatment. Those letters also come from not just individuals in art therapy, they come from our clients. They come from the organizations we work with. They come from physicians. They come from licensed professional counselors. They come from licensed clinical social workers. They come from hospital administrators who want to see that their employees in mental health have gone through the rigorous education and training to work with their vulnerable populations. They come from psychologists who are a part of the board that we're going to go under. So I just want to point out that this has been a very collaborative effort, and I think something that we're really happy to speak to is how all these different groups are coming together to show the benefit. Just to clear up a couple things that were said earlier and to talk about the profession, through the American Art Therapy Association, our national professional association that advocates for mental health, that advocates for the profession of art therapy, you can go to their website and see that there are currently 15 states that have a license for art therapy. 15, not the number that was quoted earlier. And from those states who've passed this similar legislation, we know that there's established proof for the need of licensure over certification. And that is because art therapy is not a specialty, it's not a subset, it's not a tool or modality. It is a distinct profession because we do have the same mental health training in psychological theory, human development, assessment and diagnosis that other mental health professionals have. But we have parallel with that the training in the use of art with individuals who have severe and vulnerable mental health diagnoses. So for example, what art supplies to use that are going to help an individual cope with their needs, cope with their goals, and not re-trigger or re-aggravate or make things worse, which with the nature of art supplies and the sensory use of them, how they affect what parts of the brain we're using, there is that effect of potential harm if you don't know what you're doing and re-triggering someone who's had traumatic experiences, who has depression or anxiety or suicidal thoughts. And so that is why we say it is a distinct profession, because it has that added training in how to use the art with these very vulnerable populations. Now we know from those 15 states that have licensure that when there's a license in art therapy, more jobs, more programs are created in art therapy and mental health, because hospital administrators, directors of treatment programs in mental health want to see that their employees have gone through that rigorous education and training to work with the populations that they serve. And so we're creating more jobs when there is a license. And Representative Ramsey spoke to the vast discrepancy between the number of people in Tennessee who are diagnosed. Those numbers he was quoting was pre-COVID, pre-pandemic. We know from the CDC and a study that they did in this last year that when comparing 2020 to 2019, there's been an increase of rates of anxiety by 3 times, an increase of rates of depression by 4 times, that 25% of individuals surveyed experienced symptoms of trauma specifically related to their experience of the pandemic, that 1 in 10 people reported use of substance abuse because of the pandemic, an increased use of substance, and that twice as many individuals were reporting having thoughts of suicide. Now, before the pandemic, our state was already in a crisis of mental health with the number of people diagnosed and the lack of mental health providers available to serve them. And we know that fewer and fewer people are going into graduate programs for mental health, and so those numbers of providers will only decline. And so we know in those states that have license, we're increasing jobs, we're increasing programs. When you have that opportunity, more art therapists move to the state, so you're increasing the level of providers. The art therapists who are here feel supported, they feel recognized, so they're staying here. I personally am from the South. I went to school in Washington, D.C., where there is a license, there is a lot of opportunity, but I wanted to come back to the South. I wanted to serve the place where I was from, and so I want to be able to stay here to do that. And from those states that have passed licensure, many have gone through sunrise review process. So years of research, years of data collection, of study, of hearings and witness testimony like this when reviewing the need for licensure. And most recently in Nebraska, Virginia, and Connecticut, they all released final reports recommending licensure as the appropriate level of regulation for the profession of art therapy. Virginia's executive summary states that the unregulated practice of the profession poses the potential for significant harm to the public, especially in consideration of the vulnerability of the patients the profession serves. No alternatives to licensure were deemed commensurate with the public's protection. And that is because a license offers title protection, it offers practice protection. Those are things that are in our original language that were requested by the Tennessee Psychological Association. It does not define art, it defines the scope of practice.
Ms. Harris, I'm going to have to interrupt you there. I've been told that we're supposed to have time limits on this. If you don't mind, give you just a few seconds to kind of wrap up. I've got some members that want to have questions for you.
Sure, of course. Thank you. The ability to have title protection, it's not saying that other professions can't use art. It's just the protection of the term art therapy. So consumers, so clients know that the person they're going to has that specific training. It's also setting the qualifications of education, of training for art therapists, which are on par with other licensed mental health professions. The certification that was proposed in the amendment that's now been taken off removed all of those things. It even drastically reduced the educational requirements, the training requirements, really dangerously opening the door to people to say they could practice art therapy when they don't even have the training in art therapy, let alone mental health. So that's what we're really trying to do here, is to address the crisis of mental health in Tennessee with this license, and doing so in a way that's safe and effective for the public. Thank you.
Thank you. Representative Freeman, you're recognized.
Yes, thank you. Thank you for your testimony, and thank you to the chairman for bringing this bill today. I can't tell you how much I think this is going to change therapy. My wife, who is a LCSW, who does therapy for children who are victims of rape and sexual abuse, does everything in my book right, but she's not an artist. And to try to go down the path of having a certification on top of a license is missing the point of the good and hard work that you guys do. And I want to add one more thing for some of the other members that may not have heard these stories before, but for young children who are the victims of rape and sexual abuse that don't have the words to describe the horrors that has happened to them, the ability of art therapy to help them work through those issues in a way that they can get it out is so powerful. And I hope this bill passes, and I hope it moves all the way to the House floor and passes. So thank you for your testimony.
Thank you.
Thank you. Chairman Boyd.
Thank you, Mr. Chairman, and I appreciate your testimony on this. I do have a question. I know people that are licensed counselors or therapists now oftentimes will use art. Sometimes it may be to calm a child down. Sometimes it will be so that a child can draw what they've been through. Would those folks have to get certified to, I mean, is that art therapy?
No, they would not have to get a separate license or a separate certification in art therapy. And that's something we work with a lot of these mental health professionals on. You know, we're not trying to own art supplies. We want it to be available to everyone because it is so helpful. What the license addresses really is just that term of licensed professional art therapist. So it protects that title so that individuals who are seeking an art therapist know when they see that title, the individual not only has the mental health training, but has the training in art and how to use art with those specific diagnoses. So it's not going to stop any professions, even other mental health professionals, from using art in their practice. The only issue is whether you're calling it art therapy to denote that training, or, you know, I see a lot of practitioners say the use of therapeutic arts, or, you know, bringing creativity into the practice, things like that show that, yes, you know, I am a licensed psychologist or a social worker, and I may use art, but I'm not an art therapist. And so just to really kind of make that distinction and just to raise awareness of our profession and the benefits that it has.
Thank you, Mr. Chairman. So who would be in violation of this? If there was an individual, some sort of professional that were going to be hit with a misdemeanor charge, can you describe to me what that would look like?
Sure. And it's, you know, coming from information that I mentioned in those other states that have passed license, you know, and some occurrences here too, where we see maybe an organization out of no ill will or ill intent, it's just a lack of understanding of the profession, maybe advertise for a job with the title art therapist, but the only requirements is a bachelor's degree. Or, you know, I've had conversations with individuals who maybe work in a acute inpatient psychiatric who say, oh yeah, I love art. I do art therapy with my patients, when maybe it's just a nursing tech. And so it's not that we want to take away the use of art in those situations. It's more the title of art therapy and kind of what that represents. And so the misdemeanor comes, you know, from that title protection. It's just solely the use of the title art therapy. It is not the use of art in some of these other professions or practices. And that really is modeled on, you know, bills for licensure of other mental health professions in our state have similar clauses.
Any further questions while we're out of session? Okay, seeing none, thank you for your testimony. We will go back into session. Any questions for the sponsor, Chairman Boyd?
Thank you, Mr. Chairman. And sponsor, your passion for this comes through, and I appreciate your lengthy explanation of it earlier. And it sounds like art therapy has been used in Tennessee to help people that are victims of trauma and just in all kinds of different applications. And I hope to see it continue to be used. I am afraid, though, that trying to take something like art that is used by so many different counselors and practitioners and trying to license it and contain it, I'm afraid it may actually have the opposite effect. I'm afraid less people. I think of my wife's a guidance counselor, and I think about her. I mean, if she hears about this, my guess is she's probably going to be so timid that she probably won't use it, even in the application that I was describing earlier. And so I probably will be against your bill. But I just want you to know that I understand the spirit of what you're trying to do. I just don't think we need another license here in the state of Tennessee. And it seems like the purpose of it is more to get federal funding or to get insurance reimbursement. And I'm just not sure that that's necessary at this point. I think that art is being used by a lot of different professionals, and I hope to see it continue to be used.
And, thank you, Mr. Chairman. And you can look at the fiscal review on it. They said there will be no significant infractions. They didn't put a figure on any kind of income from misdemeanors because they don't expect there to be any. And I think we have to guard against Tennessee becoming a state that buyer beware. I mean, we license real estate, we license insurance. It's all for a purpose, and it establishes a legal platform for the citizens to get what they expect that they're paying for. And as far as reimbursement, we all know that the big issues with health care. My hospital comes to me and tell me they make 20 cents on the dollar, and without being able to be reimbursable providers, they're just not going to make it. So please, in the future, this stigma of licensing is a dangerous situation. I mean, everything progresses to a point that the citizens are supposed to get what they expect. And I mean, even anesthesiologists, I think that wasn't recognized as a specialist till the 40s. I mean, everything changes, everything improves, everything becomes, and I think for that reason, we need to focus on, is Tennessee going to be a buyer beware state?
Chairman Jernigan.
Thank you. I kind of have the opposite view of Chairman Boyd. When someone tells me that they are a licensed professional, whatever it is, and this one has to be art therapy, then I know that there are reasonable standards in place, that I know that there's a scope of practice, that I know that there's education. Then I'm putting my mental health into someone who's a licensed professional. And for me, I have certain securities with that. I've been through the healthcare system the past 30 years where I've placed my health into what I consider people that are professionals, that have continuing education, that have contact education, that are licensed professionals, that have boards, that have standards in place. I find great comfort in that as someone who's seeking help, either physically, mentally. So I think this is a very good step forward in art therapy. And that way we can move forward in a profession that's going to help a lot of people, because when you help someone with mental health, there's no one size fits all. We have to have more branches. So thank you. I'll be supporting your bill.
Good. Thank you. We are coming up against a hard time here on this. If we have no further questions on this, I think, I have some concerns with this, and we've had this discussion before, but if there are no objections, I'd like to call the question on this, and let's vote on this bill, unless you have any further comments.
No, that's fine. It's my understanding, and thank you for recognizing me, it's my understanding that the next committee is not meeting, so we have time to tussle with Representative.
Oh, okay.
Hulsey
Well,
over
my,
But no,
my,
calling the
I thought
question.
I thought we were underneath a
Calling the
time
question
frame.
is fine with
If
me.
anybody,
Yes,
does
sir.
anybody object to the calling of the question? Okay, seeing none. All those in favor of House Bill 183 as amended, say aye. Aye. Opposed? No. Ayes have it. On to full committee.
Thank you, Mr. Chairman, ladies and gentlemen.
I'd like to challenge the chair with a roll call vote, please. I need two more hands. If I can challenge the chair.
You can't do the roll calls after the, too late for a roll call vote. That's got to be done beforehand, and it's got to be 3 hands beforehand for a roll call. If you'd like to be recorded as a no or a yes, specifically, tell the clerk.
Ladies and gentlemen, I have let you get out of control for the last time. So please pay attention here. I misspoke. The committee is coming in, but we are going to adjourn. We're going to recess until 3 o'clock tomorrow. 2 o'clock tomorrow. Chairman Hulsey, are you available at 2 o'clock tomorrow? Are you going to work out and build those muscles up for tomorrow? Okay, yeah, okay. Thank you, sir. We will recess until 2 o'clock tomorrow. Same room. Or, no, maybe not the same room. What room will it be? Number 1? Let me make a correction here. We're in House Meeting Room 1, not 2 tomorrow. 2 o'clock, House Meeting Room 1.